Good morning, Pauline Joe.
Good morning, Yvonne. How are you?
I'm well. I caught myself. Was introducing myself, and I was still muted.
Oh,
So
no worries.
I guess I should start again. Good morning, everyone. My name is Yvonne Everett. I am a intern at Larte Wellness Group, and today our discussion will be about attachment theory. So I hope that we can have a robust discussion about this to find out if you're using this with your clients and share with me what you know about it, this particular theory. I have become very passionate about learning about this theory. And so I look forward to our discussion today. So, Pauline Joe, welcome. I'm glad you're here this morning.
Thank you. I'm excited as well. I apologize that I can only participate until 9 a.m., but I'm hoping others can join the discussion as well, as I'm really curious, of course, what you had in mind as well as what other people are thinking.
Yeah, I just saw that Yu Yang just joined. Good morning, Yu Yang.
Hi, good morning.
Good morning. Welcome. I'm glad you're here. I was just talking briefly with Pauline Joe about our discussion today. And I wanted to talk about attachment theory. I have recently become very passionate about what I have been learning about attachment theory. And so today I would like to, find out from you all what you know about it, if you've been using it with your clients. And so glad to have you.
Yeah, I'm looking forward to today's discussion and yeah.
Great, good. So it's about 8:33. I guess we should go ahead and get started. So my interest in this started because I have a client, and we were having a discussion about his upbringing. And as those things arose, he talked about it and talked about it in relation to his adult relationship and his challenges that he's had over the years. And so in talking about that, I decided to do some research and look into attachment theory so that I can help this gentleman figure out why he was having the challenges that he was having in his relationships. And through that, I just started delving into it more. I'm just at the, beginning stages of learning about it, but I'm very intrigued with it. So I thought this discussion today could just open up more context about it and for myself to learn even more from you all. So with that being said, my first question is, have you utilized attachment theory with your clients? And if so, what have you learned?
Hi, Yvonne. I think for myself and in my growing knowledge and practice, I typically look at attachment style or attachment theory when people tell me that they have had issues with like interpersonal relationships, or say they had issues with their parents growing up. I try to give them some little psychoeducation on just the fact that, our attachment styles do come from somewhere. Like, it's not, that we're crazy, or it's not that we're silly or whatnot. It's that, there is a reason why we feel attached or feel detached from others. And so I always try to, let them know that it did come from somewhere. And it's important that we know where it came from, as almost like understanding like a history about ourselves.
Thank you. So I hear you're saying that you want your clients to look at this behavior and help them understand where it comes from, so that they are, become more self-aware, and so that they can have better relationships in the future. Is that correct?
Absolutely, yes.
Yeah. I think that's really important for people to look at their relationships and how it has, just look at the patterns of their life and how it has affected them. And so that's a good thing to do in therapy to help clients figure out what's going on with them. Thank you so much for that, Pauline Joe. Any thoughts you have, Yu Yang?
Uh, I think I'm just go with like Pauline Joe, and basically I use attachment theory just for myself to do the like case conceptualization and um, to just know better about the clients. And when clients have some like relationship issue with their like partners, and they have some concern about the like interpersonal relationship, I would try to explore a little bit about the like attachment style of them, and to let them to have more self-awareness of why where does this pattern come from, and maybe just let them to know uh, uh, this behavior and this like patterns of interpersonal relationship is reasonable, and it's come from their like history, their childhood, and yeah, just I think that basically everything is just the similar as Pauline Joe, and yeah.
Okay. Thank you. So you pretty much do the same thing. You inform your clients, you give them some psychoeducation about their patterns of behavior and how it's affecting their relationships. Great. Okay. Thank you. So, and listening to the two of you talk about how you use it with your clients, one of the things I thought was very helpful for my client was to do an assessment to find out their what their attachment style is, and to figure out, just that for the just having that information for themselves. I thought that was very helpful for clients. Have any of you all utilized that, doing an assessment for clients to find out their attachment style?
Yvonne, I wanted to clarify. Do you mean like having them do like a genogram and look at like um, the different relationships in their families?
No, what this was an assessment that I had researched and found, and asked my client to complete it regarding his relationships. And so when he completed that assessment, he was able to find out what what particular attachment style he had, which was dismissive avoidance. So answering those questions allowed him to find out where he fell.
I like that. I'm gonna have to look that up myself.
Oh,
Um,
great. I'm glad that's helpful to you. Yeah, that was very helpful to him. And he was very, he was pretty much on, pretty much knew kind of where he was based on our conversation. But when he did that assessment, he sent it to me. So it kind of clarified it. Yes, I'd be happy to share that information with you.
Thank you. The reason why I was thinking the genogram is because sometimes a genogram can show us, you know, based on the person's like family and their environment,
Yes.
were any divorces, were there any remarriages, were there any like deaths, at what ages did they happen, how did that
Hmm.
impact them, at that age, did they say have a stable home, did they not have a stable home, and so I feel like that also impacts the ability to attach, especially when we look at kind of like the different stages of life, and when like attachments happen, or when they or when like people kind of become independent from like their parents or their caregivers.
Okay, so you have that historical record of the patterns in their life.
Mm-hmm.
Great, great. Yeah, that is a good idea. That's a good idea. Thank you. Thank you. Yu Yang, any thoughts you have about that? Assessments or any of those things you've done with your clients?
Yeah, I like that assessments you just talk about, and could you please just share that information with us? Like, I think I maybe use that with my clients later.
Yes, yes, yes. I will be happy. I'll send you all an email with that information. Gladly.
Thank you
Gladly.
for that. And
Good.
as for the genogram, I have done that once with one of my clients, and she has some like conflict with her mother, and also her like her family as a total, something like that. So I think genogram is also a good way for the clients to know her attachment style with her parents, and also why her parents treat her in this way, because it's come from their like origin family. So
Yes.
yeah, and yeah, I'm really open to know more like tools and instruments for us to uh, know about the attachment style of the clients. So
Mm-hmm. Great, great. Thank you. Thank you. Thank you. Yes. Yes. So I do agree with both of you that the genogram would be another tool to be able to use to get that historical family information from the client. Would be very, very helpful. Thank you. And so my next question would be regarding attachment styles. So I looked at some information regarding a study analysis as well about attachment theory, and found out that it's not culturally universal. Um, and can someone speak on this from a cultural perspective?
I think in this instance, our cultural competencies, skills, and that we're actively practicing is really challenged, because we
Mm-hmm.
can't say, what works for one culture works for another. So there is kind of the cultural piece, but as well, we do kind of want to get to know the unique family in themselves. So there's kind
Mm-hmm.
of like some generalizations that are like fairly true. And then there is kind of the family by family or the case by case basis. And so, for instance, some cultures, it's more all about the family, versus other cultures, it may be all about like, being independent and like getting out of the house at 18 and just like, being like pushed into the deep end right away kind of situation. So I think it's important that we do ask them, exactly how it is in their family, but also kind of keep in mind kind of the generalizations of each culture to kind of have some type of basis. And it's nice to kind of compare and see, um, I guess, the differences.
Mm-hmm. Yeah, absolutely, absolutely. I agree. And so, that came up in my research, and I thought it was important to talk about that because, it's the fact that it's not universal. In one culture, you may do one thing, and another, attachment theory looks different. And so, different cultural patterns are based on different, countries of origin, and then the different ways that are linked to cultural divergence, which is collectivism versus individualism, which you kind of, you hit on some of that as well. So thank you for that portion of it, because initially I didn't, I wasn't sure that played a role in it, but now that I found that out, I'm very happy to know that, and thank you for sharing that information with me as well. Yu Yang, you have any thoughts about that regarding culture, attachment theory, and how it plays out in some people's lives as well, or maybe some of your clients?
Yeah, I agree with what you have said around like the collectivism and the like individualism. Culture would have different like definition of the like attachment style, and also I would like to bring up that culture is not only about the uh, a different country or different like racial identity. It's also maybe a bit like related to the different generation. I think for the like Z generation now and the like adolescent and this kind of person, they are just born in the uh, time with internet, and they may have different understanding of their family, and maybe their attachment style, their way of interact with their parents is different from what uh, people like from other generation do. So as for the attachment style and the definition of that, it also need to develop with the time and with the yeah, something like that. I don't know whether I'm making any sense of that.
No, you're making sense. So you're saying it could be different based on your generation and how they view attachment style, and
Mhm.
how they interact with one another as well, and what it means to them.
Yeah, yeah.
Yeah, that's yeah, I hadn't thought about that, but yeah, that does make sense. I myself have, young sons. I mean, they're in their 20s, but how their attachment is very different from how I view mine. And they're very attached to their friendships. Their close friends are very important to them. Whereas in my generations, my close maybe relatives or husband and people like that they're closer to me than my maybe my friendships. So generationally they do see it differently. Thank you for bringing that up. And so any further thoughts on that piece regarding culture? Okay. um, so another question I wanted to ask is regarding the how have you ever wondered why, like you might ask this question to your client, have you ever wondered why they keep ending up in the same situation, even in a different with a different partner in their relationship, and asking them why, if they ever noticed that or paid attention to that pattern in their life. um, this is one of the questions that I did ask my client to kind of think about what was going on in their current relationship, and to think about what a secure attachment would look like for them. Um, has that been something you all thought about, or posed questions in your sessions with your clients?
Yeah, I think several of my clients have this issue that they think they can not trust others, and they have some like issue with their partners and something related to the insecurity in themselves. And um, most of time they just think about like it is their own issue, that they are lack of self-confidence and lack of sense of security, and we just focus on more on how to improve their like positive self-talk and gain more self-acceptance, or like self compassion, something related to that. So I haven't done that in a way of incorporate attachment style, and I think it's a good point that I can do this in following sessions with my clients. And I'm curious, how do you guys do the to deal with this situation with like a way of using attachment style theory?
Mm, okay, okay, yeah. Um, uh, Pauline, Joe, you have any comments about that? Thoughts?
Sure. Typically, I try to first like investigate what are the patterns that they've seen in like their romantic relationships, and then I kind of again go back to that psychoeducation of, we learned our attachment through childhood. What was it like in your childhood? And how sometimes we end up looking for in our romantic partners like whatever void we are trying to fill from childhood. And so I definitely try to look at childhood, then I bring it into the fact that, hey, do you see a pattern here? Is this a pattern that you would like to break or not? Because sometimes clients, when we think of like unconditional positive regard, sometimes they'll explain something, or they'll explain their problem, but they don't actually want to like fix, say, like their attachment style. Rather, they just want to fix like whatever problem is going on in the relationship. So it's also important to me to understand if like their attachment style is even important to them, because sometimes it might not be, and that's okay too.
It's interesting that you brought that up, that sometimes they don't actually want to change anything. They just want the relationship to be fixed. And yeah, that's a good thought. I hadn't considered that, but yeah, sometimes clients do just want to know. They want that information. They want you to share it with them and tell them, give them information about the attachment style, but they're just not at the point or don't want to change anything. And yes, that does happen sometimes. Thank you, Pauline Joe, for sharing that. So with that being, saying that, understanding, that sometimes clients do not necessarily want to change anything, I found it important to share with clients the different types of attachment styles. And I would say look at the secure attachment style at the end, to let them know what a secure attachment style looks like. So there are like 10 signs of a disorganized attachment style for adults. I would share that information. If you all don't mind, I'd like to go through that. Is that okay with you? So sharing that information with the client was very helpful to them, for them to kind of see where they fell in the attachment style. So the disorganized attachment style in adults is, there are like 10 signs of that. For each of the ones, each theory, the 10 signs of dismissive attachment in adults and anxious attachment in adults, as well as secure attachment in adults. So I provided the clients with what those look like, and what those different signs are, and to have them write it down, to just kind of figure out where they are in in this particular in these particular theories. Um, have you all done any of that before? Shared um, that the different signs of those attachments with your clients before, and if you won't mind telling me how did they respond?
I have not, Yvonne. However, I think that's a really great intervention.
Mm-hmm.
Kind of giving the clients that interactive opportunity rather than us kind of just like, educating them. And so
Yes.
I feel like that's almost like a gentle reminder or a gentle way of making them aware that, you know, your relationship patterns are coming from the style that you have, or vice versa. Actually, not only are you gravitated towards specific people or specific like patterns of other people, but in the same way, other people are attracted, uh, for lack of a better word, like attracted or interested in wanting to be close with you. So if you have a client who says like, I'm always attracting this kind of friends, I don't want these kind of friends, why is it like that? This could be a great intervention to make them aware that, this is like the attachment style that not only are they having towards other people, but how they're showing it to other people.
Yes, 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 absolutely, absolutely, yes. So having that information, as you said, is very helpful to them and help them to recognize, what patterns of behavior they are displaying. Absolutely. Thank you so much. Um, Yu Yang, any thoughts?
Hello, everyone. Yeah, sorry for jumping in. I definitely agree with what Pauline Joe said about what you shared. I haven't actually used this attachment theories into analysis my clients' relationship with others, and I think it's very inspiring for you to share with us about like how you're actually using those attachment theories in helping like educating clients about their relationships with others, because I do have clients who have relationship concerns, like feeling either like having difficulties of building trust, or they feel like they always need to prioritize others' needs, and like others her friends like needs and wants and requests, like she has to like meet that request, otherwise she may lose the friendship. So I think it's also like a deep insecurity like in the relationships, and what we have done is trying to focus on the relationship, like to see to build that like security, to increase like how to prioritize herself, to show herself unconditional love, and also like increase her self-esteem. So just focus on self and before actually working on the relationships. But I think like the attachment style is a great actually point that you actually mentioned, and I can incorporate into my future sessions with my clients.
Yes,
Thank you
yes,
very much.
yes. Yes, thank you for sharing that. Yes, because when have that you're having your session, have that conversation with the client and helping them to recognize, their attachment style and how it's, oh, sorry. Oh my goodness. Oh Lord. Oh, I'm sorry. Oh, what happened here? Hmm. I'm sorry about that. You all still there?
Yes, I do have to go, but I want to thank you guys for this discussion this morning, and I will see you all soon. Thank you,
Thank you for
Yvonne.
your participation.
Thank you.
Bye-bye.
Bye-bye.
So, so to continue on what you were just saying, about, I'm sorry about that again. These interruptions are in my phone. Are you all still there?
Yeah.
Sorry about that. Um, so anyway, I would just, wanted to just summarize what you were just saying about your client and helping them to recognize their attachment style. And, when they recognize, what is going on with them, I think it kind of allows them to think about what changes they do want to make in their lives and how it is impacting them. I think it's very, very important for them to know that when they're sharing with you their patterns of behaviors and the things that are happening and recognizing those patterns in their lives. And I think it's very important that they recognize it and they decide, what they want to change in their lives. But having this information, I think, will be very helpful to them. So I look forward to sharing it with you all. And so with on the next my next question is, have you yourself ever thought about your own attachment styles, or do you know what yours are? And I'll share mine. I'll share my own. I did the actual assessment for myself, and I found out what mine was. And I wasn't surprised about it, but I realized that over the years, it has changed. Um, and that's one of the things I found out too, because initially you could have one attachment style, but over time it can change. And if you all experienced that or thought about that with your clients?
Uh, I I don't know how to change it, but I have reviewed my own attachment style before, and I think I also have like during college or maybe just several years before, we have done like observation for my cousins and my brother, and to see what their like attachment style, and to see how they just react when the parents leave them, and when how they react when the parents like come back again. And I found that's really interesting for the kids to show the difference of like attachment style and different reactions. And
Mm-hmm.
uh, like for me, I have reviewed my own attachment style, and I think it is helpful for me to understand my relationship with my parents. And also during the session, I think being aware of my own attachment style could help me to gain more self-awareness, and like to reduce some uh, counter transference when the like clients say something really like my experience, and I try not to impose my like um, my perspective on them, or try not to like uh, uh, yeah, to just use the counter transference in a like negative way.
Mm-hmm. Mm-hmm. Yes, yes, that's very important. So thank you for bringing that up. That's very important to recognize your own attachment style, as we know that, counter transference can affect the therapeutic relationship. So yes, that's absolutely important to recognize your own. And I myself have, made sure I'm cognizant of that as well, when clients may bring up something, or a session, or talk about something that I myself may have some life experience with, and being mindful that I don't inflict my own views upon them, but all, but continuing to be empathetic, and just being watchful of my own patterns, that could also, affect the therapeutic relationship. So thank you so much for that. Um, any other thoughts? on your own attachment style? Okay. So just so I wanted to just kind of, if anyone has any other thoughts about attachment style and how they've used it with their clients, how it's been helpful to their clients, that you can share any particular thoughts about that. Any, like if you have any clients or a particular client that you used it with, and they were able to share how they realized what their attachment style was, and how they were able to start changing it to a secure attachment.
Good morning. Thank you for this.
Good morning, Brittany.
Good morning. Thank you for this this topic, and I've appreciate everybody's input with attachment style. I have been doing attachment style with a few of my clients, and have also explored my own personal attachment style. But in clients, kind of what was mentioned earlier, I believe Colleen Joe mentioned it, was mentioning the improvement of other relationships as well as communication as a whole. I have a few different clients at varying attachment styles. Some have secure attachment styles, some have insecure, some have avoidant, but kind of working towards that secure attachment style in themselves, as well as in social interactions, has been, at least working with my clients, has been shown to help improve confidence, as well as help with communication, help improve comfort in communicating what they want, as well as even comfort in exploring emotions, depending upon what the client's treatment goals are. So overall, I've been finding that in some cases, working through attachment can help improve a lot of different therapeutic goals.
Thank you, Brittany. Thank you. So you're saying by them working through their attachment issues that they've had has helped them overall in other parts of their lives.
Yes, definitely.
Wonderful. Yeah. They said it, according to the theorist, he says it's also impacts your work life too. So knowing what your attachment style is and working through those issues to become more, secure in your attachment styles can make a great difference in your lives and your future relationships. Absolutely. Thank you for sharing that. Anyone else have any thought, anything to share about their clients regarding attachment styles and the work that they've been doing with their clients, and how the clients is using that to help them in their relationships? Okay, then I'll share just briefly with one of my clients who is in a relationship, and he has from learning about what his attachment style has been and working towards a secure attachment style, he now understands his own, which was his own style, and how that has impacted his current relationship that he's in. And so he's working towards no longer, utilize being avoidant that he had previously been in his relationship. So now he's been more observant of his partner's body language, He's more observant of his own behavior in the relationship, and has also allowed himself to be more vulnerable. And I think that was really key for him, because normally when there's a conflict, he would leave this, he would leave the room or leave the situation, whatever it was, and he would just respond in kind. But now he says he's more thoughtful about the other person's feelings. He takes time to listen to what his partner has to say. And he consistently says he wants to be a better person and have, a better relationship overall. And so I think this has been very helpful towards him. And he's also guided by some of the behaviors associated with a secure attachment. And so I think it's been very helpful to our clients by uh, giving them psychoeducation about attachment styles, so that they can have better relationships overall, interpersonal and within their own, workplace as well. Anyone else have any thoughts to share? So, Brittany, you talked about the different um, types of attachment styles. So, what I did was I produced some documents for myself to utilize in sharing the different signs of the different types of attachment styles. For example, the um, the 10 signs of a disorganized attachment style in adults. And so, for example, they're unable to regulate emotions. And, they have a strong fear of being hurt, rejected, abandoned, and, abandoned by loved ones. And they have a low self-esteem, and feeling ineffective and helpless in life. Um, can you all share any of those thoughts with any of the clients that you have that may have a disorganized attachment style?
I think one of my clients shows like uh, the low self-esteem and low self-confidence,
Mm-hmm.
and the way she tried to like compensate for that is to show her anger to her partner and to cover her vulnerability. And so in this way she would not like communicate with her partner in a more like rational way, and she used the anger to show her confidence, something like that. And actually the
Mm-hmm.
anger, the vulnerability, maybe the guilty and the low self-esteem is under the anger issue.
Mm-hmm.
Yeah.
Mm-hmm. Mm-hmm. Okay. Okay. So, okay. So your client. Oh, okay. So you direct her, show her that she convey that when she conveys that behavior. Are you able to, share with her, you know, that particular attachment style and let her know that um, how she's responding, she can change that behavior?
Yeah, not for the attachment style, but we have like explore about the anger issue and to show her the like anger iceberg, the
Mm-hmm.
that image, and to show her it is actually her vulnerability led her to like act in this way. And we just do some works around the anger burst issue, and
Mm-hmm.
also we just point out it is actually her insecurity works in the relationship, and we just work a little bit on her insecurity. But I don't like connect it with the like interpersonal relationship, and it connected with the attachment style. So
Mm-hmm.
I think maybe in the following session I could incorporate this theory into the session. Yeah.
Okay. Okay. All right. Thank you. Thank you. Thank you for sharing that. Because attachment theory is, it takes it can take quite some time to work through this, for clients to work through this, recognizing their, being able to recognize their own behavior patterns from childhood to adulthood, and recognizing how this pattern has impacted their lives up into the present, and recognizing where, where they're, where they can make changes in their lives to have a more secure attachment style. So, anyone else have any thoughts about how they're using this theory with their clients, how it's helping them? And what do you see? How do you see their relationships changing? Okay. So what I wanted to do was before get to the last portion of our this attachment, talking about attachment theory, I just wanted to give the 10 signs of a secure attachment in adult relationships. They're able to regulate emotions and feelings in their relationship. Strong goal-oriented behavior when they're on their own. They're great at bonding, opening up to and trusting others, knowing what you're about in life and what purpose you want to fulfill, can communicate your needs effectively, feeling like you have an impact on the world around you. So they feel like they have purpose, and and what they have to offer to the world is valuable. They're comfortable with closeness and mutual dependency. They actively seek emotional support from your partner and also give emotional support to their partner. They're comfortable being alone and use that time to explore. And they have a strong capacity to reflect on how they are in a relationship. Anyone have any thoughts about that? So in a secure with a secure attachment style is what the clients should be, well, hope they're seeking to have a secure attachment style. And so one of the things that I found out in my research is that it's very helpful to be in a relationship with someone who is already secure. They already have a secure attachment style, and that can help the person without the secure attachment to develop that by having those interactions with that particular person, because that person is secure. Anyone have any thoughts about that?
So could you please give an example of that? I'm just a little bit confused about the question.
Okay, so if you don't have a secure attachment style, and you are in a relationship with someone who has a secure attachment style, according to research that I have been reading, that says that you can build a secure attachment style by being in a relationship with someone else who has a secure attachment style. Is that making sense to you now?
Yeah.
Yeah. So if you, for instance, if you are like unable to regulate your emotions. If you're disorganized, you have a disorganized attachment style. And then the person you're in has a secure attachment style. That person is regulated, so therefore they can help you to regulate yourself because they're not responding in the same way that you are. So you can learn from that particular person in that relationship. Does that make more sense to you?
Yeah, thanks for sharing. And yeah, I think, yeah, I'm curious how it works in like interpersonal dynamic. And yeah.
Yeah, there's a lot more to this that I know I don't have adequate time to share all of it, but that was one of the main ways of building a secure relationship, attachment style with another person is seeking out someone who does have a secure attachment. Anyone else have any thoughts?
I haven't used this attachment style like theories before, but I definitely think like I definitely like how you actually address this, and also like you use the research, like the evidence-based practice, like use the research to help you to form your practice, like how your treatment goes. So I definitely want to incorporate those into my treatment with my clients. But because like I haven't used this before, so I don't have a lot I can share like now. But I definitely think this is a really great perspective to see clients' relationship concerns. Yeah.
Yes. I thank you for your input. Yes, absolutely. I think it's a great resource to utilize. There's a lot to learn from this research, and I have so much more to learn because there is very robust. There's a lot to delve into to learn about these different types of attachment styles from birth until our adulthood, knowing that our primary caregivers, who may be our parents, our mothers, our fathers, it could be anyone, whoever that primary caregiver is, impacts who we become as an adult, our attachment styles, how secure we feel, how insecure we feel, the way that they care for us. Do we feel like they've cared for us as well? Those attachment styles impact our relationships in a very profound way. Like if you lack a strong sense of self, and you have low self-esteem, that's part of having an anxious attachment style. Seeking approval and reassurance from others, that's also speaks to the anxious attachment style. So all four of them, if when you do the research and look into how they all play out in our lives, you come to understand a lot of the patterns of your clients as well. I understand a lot of my own patterns as well. So it's really helped me to understand my clients a lot better, and then being able to help them to articulate their lives and their childhood, and seeing the patterns of their relationships, and also knowing and understanding how they want to make these changes in their lives so that they can have better interpersonal relationships. So anyone has any final thoughts on the attachment styles? And I'll just kind of summarize the 4 attachment styles. It's dismissive attachment, anxious attachment, disorganized attachment, and secure attachment. These are the 4 different types of attachment styles. that individuals will have. Well, great. I thank you all for participating today. Um, thank you all for coming. And I hope you all will learn more about attachment theory and um, implement this in your own work with your clients. I think it will be very helpful to them.
Yeah, thank you, Yvonne. And I think the information are really like useful, and I'll definitely use that in the following sessions with my clients. And yeah, I really looking forward to your assessments and the resources if it is possible for you to share with me after
Yes,
the session. Yeah, and I really appreciate that, and thank you for bring up this topic today.
you're very welcome. Thank you all for your participation. All right, everyone. Have a good week.